I'm Courtney Mascio. I'm an occupational therapist and a certified lymphedema therapist, and I'm the professional education manager for the Lipedema Foundation. So today I'll be talking to you about how we are going to support clinicians in the lipedema care journey with our rollout of the Clinicians Guide and the Provider Directory. I have nothing to disclose, no disclaimers. Okay, so I have a quick poll. So if you're a patient or someone with lipedema, please raise your hand. Okay. Please, I'm sorry. If it took you at least a year to get diagnosed with lipedema after you first sought medical attention, please raise your hand. Okay. Please keep your hand up if it took you at least 5 years. Please keep your hand up if it took you at least 10 years. Okay, wow. All right, this is another poll. So if you are a clinician or a healthcare provider, please raise your hand. Okay. Please keep your hand up if you felt totally confident identifying or diagnosing lipedema right after you graduated with your healthcare degree. Okay. So let's talk a little bit about the patient journey and the Lipedema Foundation registry. So the registry is an online survey. It was created to learn more about lipedema. It was launched in 2019. So in 2022, we created the First Look report, and that included data from the first 521 fully completed registry surveys. So what we found with that data was that on average, women sought medical attention 17 years after first noticing lipedema symptoms. After that first engagement, it typically took another 10 years to receive a lipedema diagnosis, and I think we just showed that. So over 50% of patients were reporting an onset of symptoms around puberty, but the average age of diagnosis was about 48 years of age. And here is a QR code if you'd like to download the First Look report. I highly encourage you to take a look. Lots of interesting data in there. So there's an obvious gap in the field. So with diagnosis. So what we were hearing was there was this need for an informational guide or flyer that was designed for doctors and other diagnosing providers. It needed to be concise, credible, and visually demonstrative. This sparked the idea for the Clinician's Guide to Lipedema. So here are the goals of the Clinician's Guide. So one-page front and back flyer. It needed to be easy to parse while still providing enough useful information. We wanted to legitimize lipedema as a real condition that providers should care about. We wanted to empower clinicians to feel more confident diagnosing lipedema and decrease the average time to diagnosis and receiving appropriate access to care. Here are highlights. So, common presentation, this is a snapshot of the typical ways that lipedema presents. There's also accompanying photos. Photos are worth 1,000 words. It's very helpful for a clinician to take a look and compare that to a patient that they're evaluating. We wanted to walk through clinical diagnosis. So obviously there's not a biomarker or an imaging test that can help diagnose lipedema right now. So it's very important to sort of walk the clinician through what a clinical diagnosis looks like. So that's through patient history and physical examination. We also highlight medical coding. So we talk about frequently used ICD-10 codes right now. Those actually are not lipedema-specific codes. So a lot of what people are using are R60.9, which is swelling and edema. Some people use E65, which is localized adiposity. There's a few others that are being used, but there's not a specific lipedema code with an ICD-10. But we did want to highlight that the World Health Organization has established a lipedema code, an ICD-11, The United States is not using that code right now. We don't have any indication of when that might happen. But we thought it was really important to highlight that it has been recognized as a distinct condition, and that code is EF02.2. We go over common treatments. This is a very brief introduction to frequently used treatments in the field. It's not all encompassing. That's why we link to the Lipedema Foundation's Treating Lipedema webpage so that providers can kind of get more information and dive a little bit deeper. We also go over referrals. Again, this is a non-comprehensive list, but we wanted to highlight some appropriate professionals to which a newly diagnosed patient could be referred, which includes CLTs. We've heard the Clinicians Guide is being put into practice, which is great. We heard that patients are using it as an advocacy tool, so uploading to their electronic medical records or sharing with their doctors via message or in person. It was also warmly received from therapists who were looking for a tool that would help educate referring providers that were not familiar with lipedema. And here's the QR code. You can download the guide for free. We also just made it available to order copies if you would like on our Contact Us page. And if you stop by our booth, we have plenty of copies too, and we'd love to talk to you more about it. Okay, so if we're helping clinicians to be confident in diagnosing, what's the next step? So super important to refer out for appropriate treatment. One of the top suggested referrals in the guide is a therapist who treats lipedema. That's often going to be a CLT or a certified lymphedema therapist. We'll talk a little bit about the role of therapists in lipedema care. So CLTs are specially trained to treat lymphatic system disorders, usually receive education on lipedema. They're often physical therapists, occupational therapists, or massage therapists. They offer complete decongestive therapy, so that consists of manual lymph drainage, compression garment recommendations, tailored exercise programs, and education for good skincare. There are also therapists who are not CLTs who have a wonderful skill set that can still offer treatment for patients with lipedema. They can do things like manual therapy, soft tissue mobilization, recommendation for pumps. And research has shown that patients with lipedema do benefit from these therapy techniques. The problem, finding a therapist. So we are frequently asked for help to find a professional who can treat patients with lipedema. While there are other lists of CLTs that exist, it can be difficult to identify if that particular CLT treats patients with lipedema specifically. So some CLTs only do oncology-related lymphedema, or they only do wound care. So you're kind of trying to go down a rabbit hole and figure out if the therapist sees someone with lipedema. There are also some therapists who are not CLTs, but they offer advantageous treatment for patients, but they're not on an easily accessible list. So our solution was the Lipedema Foundation Provider Directory. We're so excited to be launching this right before FDRS. So this is a resource designed to help find therapists who have identified that they treat lipedema in their clinical practice. They are self-reported, so they are willingly signing up for this directory. We hope that it's going to be a resource for people with lipedema, healthcare providers, and the broader lipedema community. So this is the QR code. You can access the provider directory now. This is not an inclusive list, so we know that there are tons more therapists out there who are offering great treatment for lipedema patients. We're very excited that we have over 150 therapists signed up for our directory right now. We're hoping that that's going to continue to grow. But again, it's not an inclusive list. We also just want to highlight that the Lipedema Foundation is not specifically recommending any medical provider. This is just a great place for you to start. We are starting with therapists in our first version, but we do have plans to expand that to diagnosing providers and then probably surgeons down the line. What we include right now, so you'll see the therapist name, their credentials, the type of treatments that they offer, their affiliated organization, and their contact information. So what we don't include in this directory is if they accept health insurance, or if they're cash-based only, if they have a waiting list, or they're accepting new patients. So again, this is a great place to start, but you would need to contact that therapist and get more information. So we have a call to action. So patients, if you have a therapist that you absolutely love and they're doing great things for you, we want to hear about them. So please stop by the booth and we'll give you more information for how to get them in the provider directory. These are just some more helpful patient education materials that we have. So we have our Lipedema Foundation brochure. We also have a patient self-advocacy guide. And then we have an infographic. We also have a brand new For Clinicians section of our website, which we were really excited to get going. So within that section, you'll find support for diagnosing, treating. You'll find the clinician's guide there. We have an ICD codes page. We also have a videos and CME page, and that's lipedema.org/clinicians. And if you have any questions or comments, we'd love to hear from you. Especially with the clinician's guide, we expect that this is sort of a living document, so it's going to be updated. We want feedback, how it's working for you in the field, success that you're having with your clinicians if they're using it. So please email us at clinicians@lipedema.org. We'd love to hear from you, and please stop by the booth.